Bacteria known as Group B Streptococcus (GPS) are a common cause of blood infections, meningitis, and stillbirth in newborns. Although GPS infections can often be treated or prevented with antibiotics, the bacteria are becoming increasingly resistant. Now, researchers have discovered that human milk oligosaccharides (HMOs), short strings of sugar molecules abundant in breast milk, can help prevent GPS infections in human cells and tissues and in mice. Someday, HMOs might be able to replace antibiotics for treating infections in infants and adults. The researcher says that their lab has previously shown that mixes of HMOs isolated from the milk of several different donor mothers have antimicrobial and antibiofilm activity against GPS. They wanted to jump from these in vitro studies to see whether HMOs could prevent infections in cells and tissues from a pregnant woman and in pregnant mice. According to the US Centers for Disease Control and Prevention, about 2,000 babies in the US get GPS each year, and 4 to 6% of them die from it. The bacteria are often transferred from mother to baby during labor and delivery.